Ladies and gentlemen, my name is Michael Hubbard. I'm from Cape Town, South Africa, and today I'm presenting you my idea, which is poco, a mobile healthcare solution. But before I begin telling you what poco is actually about, let me tell you a personal story. This is a very personal experience that I had about 1.5 years ago. I was involved in a very serious motorbike accident in which I suffered a very compound fracture to my left femur and lost a lot of blood. This happened in Cape Town, one of the most modern cities in Africa. So therefore, I was very lucky to receive medical treatment. This is in fact a picture of me in ICU the day after. But if this had happened to me in a rural area, away from medical facilities and emergency medical care, I would probably have died. Now, with poco, this may not have happened, because what poco does is connect people that are far away from clinics and doctors to these doctors and allows them to receive medical feedback and consultation as well as first aid instructions. So how does this work? Basically, poco uses SMS technology as well as other mobile channels to allow users in rural parts of Africa, since cellular technology is the most pervasive of any mobile technology or any other technology in Africa. So they send a simple SMS through the poco system, which will use government public healthcare clinics and deliver these, where a nurse will then give the message a priority and a doctor will then respond. This allows for quick feedback on medical issues, and thereby you can know, do I need to actually go to the clinic, which is 30 kilometers away, and may it take me 4 hours, or is it okay, you know? So the target is obviously the very poor and remote areas in Africa. These usually do have cellular coverage, but may not have buses or public transport or any other form of connection to the outside world. So the idea is use cellular coverage and extend government's public healthcare services to everyone. So the real value of this is that it's a uniquely integrated healthcare system. So it allows the government's public health services, which in South Africa is free, to extend beyond the physical locations of the medical facilities and allows doctors to actually target any South African. And then using SMS revenue share, this not-for-profit scheme would be able to be self-sustainable, since the actual costs of implementing it are minimal. The initial upfront cost would be less than 500 francs, while the day-to-day running cost would be about 20 francs a month. Competitors MTN and Sanlam together have launched a similar system, but it's privatized, it's for profit, and it's only for MTN subscribers. Vodacom is launching a similar system. I'm in talks with the Western Cape government, the provincial government where I stay, and my university, the University of Cape Town, the Information Systems Department, has also pledged their support and offered me the use of their facilities as well as knowledge resources. So how do you actually get this system to work? So it's very important that users are actually educated about the system. They need to know that it exists, what it can do for them. So you need to go into the communities, use community outreach, gather the communities and tell them that the system is available, that they can get medical aid, medical advice on their mobile phones without having to travel for hours sometimes. And also using billboards and pamphlets. This is really the only high cost of the system, since it builds on government's existing infrastructure. And then the structure that is poco, it's all not for profit. You know, there's very implementation cost, as I mentioned, 500 francs, and using SMS revenue to sustain itself. And there are a multitude of available options for poco as well, such as using the data gathered to build a database of where illnesses are emanating and how they spread in the country. So in the future, there are basically 3 options for this idea to grow. You could hand it over to government to integrate into their healthcare system, making an integral part. You could run it as a private, not-for-profit organization, parallel to the government's healthcare services. Or a third option is running it as a private, not-for-profit, and having a separate entity which offers a more feature-rich experience to middle-class customers for profit. So ultimately, there is a variety of options available. So this is why I think I can make this happen, because I'm an entrepreneur. I've been running my own business for the last 2 years as a web developer. I'm also a student, just completing my 2nd year of information systems at the University of Cape Town. And ultimately, I have the right location. I'm in Africa. I'm in Cape Town. It's a very modern city. An hour away from me are villages that are quite isolated. And then ultimately, 8,500 francs can go a very far way, and I believe I can have a prototype ready and working in just a few months. Thank you.